You cannot expect a healthcare professional to get closer to the emotional needs of a patient if nobody gives a damn about them. And I think we need to implement many, many more systems changes, and that includes getting help for doctors. Times change, attitudes change, but you will still find in healthcare a few dinosaurs saying things like, in my day it was much worse and we just got on with it. Just because somebody else managed to get through a rotten system, that doesn't mean we should force it on others. Indeed, we have a responsibility to try and make things much better. There are surveys worldwide showing that many patients are increasingly dissatisfied with the care that they get from their doctors. They feel doctors lack awareness of the emotional impact that cancer has on them and act sometimes with a degree of indifference. This isn't because doctors are bad people. Most doctors go into the profession because they care so much about the patients, but it's precisely those doctors who are liable to experience what we call in the trade burnout. There are lots of different signs that somebody's approaching burnout. People can cease to get enjoyment from their work. They're depressed very often. They feel depersonalized. So why is this happening? Perversely, the improvements we've made in cancer actually mean that more people are surviving, so there's more people being treated. Throughput in our clinics, cost containment, the tyranny of emails. These are all contributing to putting pressures on doctors. There are lots of interventions in terms of therapies that can help enormously, but I'm more interested in going back a stage and helping doctors really think hard about self-care. Drink less, don't smoke, eat proper food, exercise more, sleep better, have downtime with the family, doing other things. We advise other people to do all this, but really some of the most committed doctors I know don't make the same sorts of changes in their own lifestyle. And then I think if we go back to the work setting, I think it might need some clever negotiation with management about expectations that people have on the size of clinics and the workloads that they have. And at the end of the day, I always advise people that being an oncologist or a surgeon or a nurse should be what you do. It shouldn't be who you are. The presence of a good, well-run multidisciplinary team is a highly protective feature in preventing burnout because everyone supports each other. Team training can be quite important. People who've attended well-run evidence-based communication skills training programs actually are less likely to experience burnout. Making things more efficient can help. And within all of our hospitals, we do have systems and forms that we have to keep interacting with the computer on that nobody understands why we still have to do this, and does it matter? Repeatedly, patients complain about being asked exactly the same questions that should be already there. The reason most people came into medicine or nursing is because they love people. And if you spend most of your day interacting with a computer, what fun is there in that? Getting rid of unnecessary things, I think, is one of the things most of our organizations could do, as well as it being mandatory that people have got debriefing facilities, mentoring facilities, and counseling facilities. We all have to do mandatory training on fire extinguishers and goodness knows whatever else. Well, I think we need to extinguish the fires going out with burnout.